ELISA technique determines whether a specific antibody, for example, HIV antibody, is present in a sample such as a serum. In this case, the appropriate antigen is first absorbed onto the walls of a strip of microwells. Serum that may contain antibodies against the antigen is added to the well. If antibodies are present in sample 1, they will bind to the antigens that are absorbed onto the wall of the well. If the sample contains only non-specific antibodies, they will not bind to the antigen in sample 2. Rinsing removes any antibodies that do not specifically attach to the antigen absorbed onto the wall of the well. If antibodies do attach to the antigen, they can be detected by the addition of an antibody enzyme conjugate. These reporter antibodies bind to the immunoglobulins, generally IgG, used in the previous stage. Since this specimen contains human antibodies, we use enzyme-conjugated anti-human IgG antibodies for the reporter. If the antibody was present in the sample, it will be bound to the absorbed antigen, and the enzyme-conjugated antibody will bind to this complex. The sample is again rinsed to remove any unbound antibodies. The substrate for the enzyme is now added. A color change indicates that sample 1 contains antibodies that react against the original antigen, a positive test result.